It has been a while since I've done any videos. Last few months I have been very busy with work and also basically writing a chapter on a book which I've been invited to write on. Initially I was asked to edit on the whole book, but I didn't have time for that, but I agreed to do the chapter. It should be published soon. I'll keep you all up to date. Looking through my videos, the last one I've done was actually 3 months ago. It was quite a while ago. It was on the very difficult embryo transfer. Once again, just like anything else, nothing is the same for different patients. You probably, if you've done enough embryo transfers, you will remember those very difficult cases. I'm very glad that I've just put up a photo of a baby basically recently that I've delivered recently following a very difficult embryo transfer. And I remember I told the patient it was the embryo transfer of the year. So it has been hashtagged by the patient. I'll do a new video. It will follow suit soon. Just checking, the lighting is good. Cameraman is ready. Let's roll. 3, 2, 1, beep. Good morning, I'm Teoh, specialist in fertility, obstetrics and gynecology in Perth. I hope everyone stays safe at home in this lockdown, and hopefully everything will be over soon and we have no new cases. Right, the topic today I'm going to talk about is on instrumental delivery. So sometimes when we aim for vaginal birth, patients may, for any reasons, a few simple reasons or common reasons rather. For example, sometimes we can't allow the mom to try to push too long because of heart conditions or anything. Sometimes the mom's been pushing for a long time with no success. Or sometimes babies becoming unwell and we need to deliver babies sooner rather than later. So we perform instrumental delivery. Now, one of the things as mentioned in the past, I always aim for natural birth if possible without the help of instruments. Sometimes you have to. Just like anything else, we want to aim for things to be as natural as possible. But there's different steps. If it's not possible, then we may think of instrumental delivery. Then the last resort, if it's still not possible or not safe enough, then we do cesarean section. Instrumental delivery essentially can be broadly divided to 2 instruments, forceps and vacuum delivery. Again, there are different types of forceps, there are different types of vacuums. Essentially, the more different instruments, they all have their pros and cons. And the more instruments an obstetrician knows to use, the more likelihood of potentially achieving a vaginal birth rather than have to move on to a cesarean section. When looking after women in labor, I don't rush in to do instrumental deliveries just because I want to go home or anything. Just like anything, as I mentioned before, you allow labor to go as naturally as possible, as long as it's safe and it's effective. If there's any reason I need to use instruments, I need to think carefully which one to use, plan, work together with the parturient, the person in labor or the woman in labor, and perform it safely. Many times we manage to do instrumental delivery in the room safely. Sometimes we may have to move on to theater to do instrumental delivery. For example, slightly more difficult cases where we think, look, maybe this baby can come with instrument, can be delivered with instrumental delivery, or maybe not. Then we have to be ready to do a cesarean section. Sometimes for battle pain control in the room is too uncomfortable. Then might say, look, let's go to theater with the help from anesthetist to make the patients more comfortable. Sometimes when you have to use spinal or top up the epidural, where everything's relaxed, then patients can deliver more easily with the help of instruments. Now, usually those cases, as mentioned, that you need to bring the patients to theatre, they are a bit more difficult to deliver vaginally. Those are the cases you have to plan carefully. Now, in the UK, we used to do audits of the hospital, but we found that the more experienced the obstetricians are, the more likely the patients can deliver vaginal safely. For example, some hospitals, they compare to decision making between senior registrars. Senior registrars essentially are very experienced trainees. They're not quite specialist or consultant yet, but very close to it, maybe within a year or so, or less than a year. And compared to experienced obstetricians doing what we call trial of instrumental delivery, plus minus maybe cesarean section in the room, in theatre. What they found that senior registrars, when making decisions, will have perhaps a higher cesarean section rate as compared to consultants making the right decision to deliver vagina safely with the help of instruments to achieve a vaginal birth. Now, this is one of the main contributing factors in reducing the rate of cesarean section in certain hospitals in the UK. Now, internationally, even in private practice, the cesarean section rates or the chance of cesarean section, when you mention trial of instrumental delivery in theatre, it varies between specialists. I remember I've been to theatre in the past and performed instrumental delivery, help patients to deliver vaginally, and there was comment made say, look, my patients has got a higher chance to achieve a vaginal birth compared to some other teams. So, it is essentially, in summary, we don't do instrumental delivery for no reason. We want to use it only when we need it for safety and for effective delivery. And also, if patients go to theatre for trial, you want to basically assess carefully, check the whole story. When it's safe, you want to give patients a good chance, working with patients, discussing the different options. And if it's safe enough, instrumental delivery essentially is a very important factor in reducing the chance of cesarean sections or the cesarean section rate for a particular obstetrician or team looking after patients. That's it for today. Bye. Actually, I'm not quite going away yet. Forgot to mention one last thing, very important thing. If you and your obstetric teams have delivered the baby safely with the help of instrument, don't feel disappointed or don't feel that you have not done a very good job. It is very common that women need instrumental delivery with the help of instrument. You are still the one that do most of the work in pushing, helping the team to deliver this baby. The obstetrician or the team is helping you, doing a little bit of job to add on to deliver this baby safely. So you still should be very proud of yourself that you have achieved a vaginal delivery, sometimes more difficult than other women. But you have achieved a safe vaginal birth with a little bit of help, which is very common, especially in first-time mom. So you should celebrate that and be proud of that. Okay, that's all I want to say today. Actually, I'm going to my COVID jab, my first one. Managed to get one appointment finally. In the past, I've made a couple of appointments, but I had to cancel them because last-minute deliveries, patients came in labor, so I've had to cancel twice. Today is the third time lucky. All right, see ya.